Good morning and welcome to our second 2025 Community Connections. Today we have a guest with us, Crystal Barrett O'Loughlin, who is the founder and CEO of Caregivers Global. I had the fortune to meet Crystal 2 years ago through a partner organization. So I'm going to give a shout out to Indo-US Rare, the Indian Organization for Rare Disease. And for the last 2 years, we have been participating with Indo-US Rare to basically do what we do, advocate for rare disease and as a whole and individual rare diseases. And not only just here in the United States. In November, we were in India, November last year. And it was wonderful. So I talked to Chris and I said, I got to have you on the Community Connections to tell everybody what you do because caregivers are such an important part of keeping our community healthy. So without further ado, I am going to turn it over to you, Crystal.
Thank you so much. Oh my gosh, I'm so honored. I'm so honored to be here today. And, Rare Givers is all about care, self-care. Caregivers, as patients, we need self-care and also our healthcare professional community. So I'm just excited to offer some perspective today on ways to bring micro moments of self-care into your life and also why it's so important that we do that so that we can all do the good work that we do from a business standpoint, but from a personal standpoint, so we can love on and take care of everyone else that we take care of, and we can love on and take care of ourselves. So that's what we're all about today. And I'm just going to go ahead and jump in. This is scheduled as a 1 hour presentation. I'm going to keep it to about 45 minutes. And that way, if there's any questions at the end, or we just want to sort of roll into a nice, easy breathing session or something, we'll have time to do that. I love working in rare disease. I am from this community. I'm going to share a little bit about our family story as well. But the idea here is really to ease this experience for our community. And I've been working in technology and entertainment for most of my career, but always on the side. This is actually our 25th anniversary of our organization this year. Always on the side doing fundraising, holding patient support groups, bringing together donors and individuals that healthcare, health and wellness practitioners into our community. So this has been going on for about 25 years. The last 7 years, it has been my exclusive focus, and I'm so honored to be able to do this work with the partners that we have. And so today, really what we're going to talk about is non-traditional kind of business conversations and more about empathy, just this personal experience of living, not just living with complex medical conditions, but just living. I mean, empathetic response is sort of ingrained in us. We are born to elicit and respond to the cry of others, right? So this baby, right, has a perfectly attuned cry to get the care that he or she needs from the loved ones in her life, likely her mother, right? That is fundamental, built into us as human beings. And what that triggers in us is this heart-led feeling, right? It's this loving response. Okay. And we have this huge capacity for love. I always say, if you have more than one child in your family, or you realize, you actually can take care of your friends, you can take care of your parents, your spouse, your partner, people at work, we tend to give. We give that loving response is something that we give and we give and we give. And often we give so much of ourselves, especially when someone is hurting. Because when we see that someone is in crisis or someone is sad or someone is hurting, or in need, that triggers that even deeper level of responsibility and response. And that is what makes us human. And that's a beautiful response. But sometimes we go so deep into that response that we forget we are actually worthy of the same loving response that we're giving to others. So that's what I'm here to talk about today, is just to remind you that you are worthy of that same care and thoughtful and loving energy that you're giving out to others. And so we're going to do the most powerful thing that you can do for yourself and really for everyone around you. We're going to take 3 deep breaths together. Okay, so this is the first act of self-love. So I'm going to ask you to take everything out of your hands, to put your feet flat on the floor, and really just close your eyes if you'd like. And we're just going to take 3 breaths deep into our belly. And if you like, you can be kind of vocal on the out breath. That's also helpful. The vibration is helpful. So we're going to take a deep breath in and release. And the second breath, a deep breath in, hold it, and release. And the last one, deep breath in, hold it, and release. If you'd like, you can gently open your eyes, and you probably feel just a little bit floaty. That is your parasympathetic nervous system calming down, right? So, no matter where you are, you can take a quiet breath or a more vocal breath as you're transitioning from work life into home life. If you're sitting in the lobby before a doctor's appointment, wherever you are, you can bring careful, mindful, thoughtful breaths into your body and into your psyche. And that's the greatest act of self-love that you can give yourself, is just breathe, but do it in a very mindful and thoughtful way. So heal thyself first is really the mantra here. Because what happens is life has a tendency to throw curveballs, things that we did not expect. And in our life, in the Barrett family, that actually happened in my parents' generation. So I say my parents are the strongest people I know. Richard and Phyllis met in the 60s. My father was captain of the football team here at Western High School in Southern California. My mother was head drill team leader of the pirouettes drill team, 160 dancers on stage and down on the field. And they fell fast in love. They are just kinetically attracted to each other, and in a very beautiful way. And they said to their pediatrician, "Watch out for us because we're going to have a big family really fast." So they had 5 children in 8 years. So on the right, you can see a picture of my young mother and my oldest brother, Richard. And then I'm the youngest in the lineup. And as you can likely tell, David, Jared, and Randy were developing quite different than Richard. So as a young mother, you don't know what to expect in terms of development milestones. And, Richard was kind of the golden child, could, see that he was developing in a standard way. But David and Jared and Randy were having a harder time lifting their head, crawling on time, and just having those sort of standard developmental milestones. And it took quite a while, but they did finally diagnose my brothers with a rare genetic disease called Hunter syndrome, or mucopolysaccharidosis. So muco stands for mucus, poly stands for a lot, and saccharidosis stands for sugar. So the boys were missing the enzyme. My brothers were missing the enzyme they needed to break down certain types of glucose in their body. And they did pass away at 12, 18, and 19 years old in the 1980s. So you can imagine that our entire family was oriented around caregiving and caring for two healthy children, or typically healthy children, and three developmentally challenged children was a very stressful, chronically stressful experience. And eventually, in 1975, my parents did actually divorce because of the chronic stress. They were so young, they really just didn't have the skills to talk it out and say what they needed in the relationship. And stick around to the end of this presentation. I'll give you a Hollywood ending like you can never believe. But just dealing with the passing, right? The anticipatory grief and then the reality of grief. And after my last brother passed away, I was actually 15 when Jared passed. We all kind of scattered. My brother went to Hawaii for 35 years. My parents sort of went off in various ways of coping, in particular on my mother's side, and she's very open about this. Her coping mechanisms were not always in service to her. So, deep reliance on alcohol, gambling, things that would allow her to escape the reality of what had happened. So, again, didn't have the emotional support skills at that time of her life. And so it really caused a lot of havoc on herself and on the family. So I live with that experience, right? And so many of us are motivated to engage in community and engage in rare disease specifically because of our lived experiences. And always I had the caregiver and the sibling perspective, but it wasn't until I actually became a patient that I realized, wait a second, we might be able to do things really differently in rare disease. How can we think about this a little bit differently? So in my late 40s, I did go in for a routine mammogram and I came out with a breast cancer diagnosis. And I will tell you that I received so much support. It was so scary. It was just devastating. I had a young daughter. She was 10 years old. I was 10 years into my marriage. And it was just devastating. And I was very nervous. I was scared, but I received so much support. I remember just this outpouring of phone calls from nurses, and people in society tended to know how to handle a breast cancer diagnosis. I look back on it in retrospect, and Susan G. Komen Foundation and some of the cancer coalitions have done amazing work in making awareness of how to even just talk to individual patients that are living with breast cancer and other cancers. So I'd like to say thank you to everybody in my friends and family and work network for being there for me, my doctors and nurses as well, because I am 8.5 years cancer free, and I'm so grateful to my Pi Beta Phi sorority sisters and those from UCLA. And I didn't really even know if I was going to see my daughter graduate from high school, but she is. She's graduating in June and she's heading off to University of Oklahoma. So I'll try not to get too choked up, but I just feel very grateful to have lived this part of the journey. And I'm sure that you have your moments of mortality, right? Because as young adults and adults, that's what happens. Eventually, at some point, you become aware that we're on this planet for a limited time. This isn't a dress rehearsal, right? We are born, we live out our lives, and we pass on the baton to the next generation. And I think what I've learned from this experience personally, that the illusion is a life without suffering, that there is no light without the dark, that joy and grief are the yin and yang of the human experience. And I'm so grateful for that perspective because it does put me in a mindset of gratitude. And specifically as a patient, what it helped me realize that the purpose of suffering is really to marinate your heart. And I used to think, oh my gosh, like that makes you such an evolved person. But really, it's not about me. It's actually not about us as individuals, what this marinated heart does is it helps sow the seeds of empathy. It helps us be there for someone else in our lives, to show up for others in a way that we never thought was possible. And I'll give you an example. I even remember I started feeling like, gosh, this must be so hard on the nurses and the doctors that are caring for me. I would go in for my treatments, and so I started dressing up as Wonder Woman every time I would go in for my treatments, partially to kind of distract and create a different mindset, because I was finding I was having these kind of PTSD responses every time I could see the treatment on my calendar. So I would use Wonder Woman as a way to kind of put on an alter ego and just go into the hospital environment, and always like spawn conversation. And I still use Wonder Woman as a tool today. I have my Wonder Woman mug here, and use it every day to remind myself that I'm stronger than I know, and that there's a lot I can do to bring ease into this experience. But it did change me very profoundly. And what it helped me realize is that we have to focus on our feelings. That so often when life gets medical, we start focusing on the fix. We start focusing on treatments, hopefully cures. And I know in our lifetime, we're going to see more treatments and cures for all of the conditions that we're living with, including sickle cell, including thalassemia, and including Hunter syndrome and mucopolysaccharidosis and breast cancers and others, right? So we're in this together. And the communities that are doing a really good job of focusing on feelings, but didn't used to do a good job, but military and veterans care circles, dementia care, Alzheimer's, senior care, cancer care, breast cancer in particular. Those care circles are doing a good job of getting people talking, right? And so that's really what we're trying to do at Rare Givers, is we're just trying to get people to talk about their feelings, but we recognize in a very heart-led way that these are difficult feelings to talk about. And so we're trying to make those feelings just a bit easier. And so I have this really fundamental belief that, when life gets medical, people get emotional, and we need to do more to support and create space in time, but also space in stigma, because sometimes there is this like, oh, don't get too emotional feeling. And we want to sort of break down that reaction in the genetic counselor's office, in the PICU and the ICU scenarios, in the pediatricians, in the diagnostic centers, in the doctor's office. We want to make it okay for people to have appropriate emotions when they're delivered, for some people, catastrophic news, right? It's not reasonable for us to expect that there wouldn't be emotion in a care environment like that. And the reason we have to focus on this is because in our community, this is not a one-off, right? Rare is not rare. And we know the numbers, but if you don't, majority of organizations say there's 350 million people worldwide that are living with rare, chronic, and complex diseases. So some say 400 million people now, right? So we're talking about 1 in 10 families. This is not a one-off. This is a legitimate and very prevalent part of our society. So this is a societal issue in every society. It's more people than cancer and AIDS combined. Half of our patient population is children, and we only have treatments for 5%, and we have no cures. Now, we're starting to see glimmers of cures, right? We're starting to see gene therapies. We're starting to see really amazing advancements in science. And I think in our lifetime, we are going to see the cures that we're looking for. And likely they're going to come from rare disease, because it's typically one sort of DNA or genetic sequence that's causing these outcomes. And so if they can find the pathways in rare disease, then those are the blueprints for bigger disease communities or more complex disease sets. So it's a very large community, but here's what I call empathy math. Okay, you do the math, and you don't have to be good at math to do this equation. I'll tell you right now, my daughter's struggling a little bit with calculus, but she's starting to get the hang of it. But this one you can do, okay? If you've got 350 million patients and caregivers and care circles times 0 cures, what do you have? Right? And it's actually not a number. It's a global mental health crisis. Okay, this is so obvious, but so unrecognized in our community. And so we have to bring attention to this reality because this is not just caregiving. This is not just symptom management. This is a radical medical experience. This is extreme caregiving. This is extreme medical management. This is causing deep financial hardship in our families. It's causing social isolation, career disruption, and we're just starting to touch the tip of publishing data. We have data coming out in OrphaNet. Every Life Foundation just published the rare burden of disease study. NORD is publishing studies, Rare Disease International, Global Genes. All of us are doing our best to try to document the impact of this. But here's the thing. It's not just the patient community and their families and their social networks. It's all of the doctors and nurses and patient advocate leaders and marketers within large corporations. It's all of the people that are touching this community, that are on this journey with us, that are invested in the emotional outcomes, and that when someone is suffering, they are suffering too. So we estimate on average 3 to 5 caregivers, on average 5 to 10 care partners in the professional community, right? Your teachers are on the journey with your children. Your doctor is on this journey with you. And we're actually coming in and doing a lot of relief services for cardiologists working with Marfan communities, which cause enlarged hearts, because the treatment is to do heart surgery, but there's no cure for the actual disease itself, right? And so it's causing distress cycles, and we know how dangerous that can be because of COVID, right? The system starts breaking down. So what do we do? What do we do when we have this very large challenge? How do we start breaking down that impact, and how do we move beyond the realities? Because the burden is falling heaviest on women. Women are the primary caregiver 82% of the time, on minority communities, and in particular on people experiencing poverty that don't have access to the resources, and also don't have access to resources in their native language, because that's one of the greatest barriers, is language when you're talking about working with global communities. So we know, actually documented, that 80% of rare caregivers are experiencing depression, anxiety, and what we call chronic traumatic stress. It's not post-traumatic stress, it's chronic traumatic stress. And we'll talk about that in a minute for those of you that like to really intellectualize these stress responses, because then you can intellectualize the relief response as well. So I think that's important. It's also important to note that because of that stress, it's buried, it's ignored, we have escape tactics, but because of the stress, 50% have missed a doctor's appointment, dropped out of a clinical trial, or come off of active treatment because of the medical stress. Okay, so if you're coming off of treatment, or a teenager is, or a child is coming off of treatment because they can't handle the needle fear of going in for diagnostics or an injectable, right? Or they can't handle the stress. And I'm telling you, remember what I said, I dressed up as Wonder Woman, because it's not something you can just talk about emotionally in your mind and just get over it, right? It's not a get over it response. These are deep-rooted stress responses, and the really only way to move past it is to put our feelings first, to get into talking circles, whether those be peer-to-peer circles, talking to someone in your family, talking to a pastor or a chaplain or somebody at your church, talking to someone at work, and possibly even talking to a professional. If you can't afford the professional, you can call NAMI. National Alliance of Mental Illness gives 12 30-minute sessions for free. You can text 988 and get on a crisis hotline. You can reach out to Mental Health Americas. There's so many resources that are free and available, but really, really, we have to talk about our feelings first, because these emotions are not easy to recognize in ourselves, and they're just not easy to bring up with like friends and family even, right? It's so frustrating and hard to share things that are deep in your heart that you just don't feel comfortable even recognizing the words. So what we're trying to do is take words that are difficult to talk about and put them in a format that makes it just a little bit easier and more friendly to talk about. And the reason why is because we can do this today. So while the science is progressing, we as a community, as a society, as a global human race, we can deliver emotional relief today. And we can do that into all of the care circles. So it's a huge problem. I remember thinking like, for 2 years, I would just stress about this, wake up in the middle of the night. What can we do? What can we do? 350 million families, a huge 2.8 billion people. How can you affect change into such a large community? But then I remembered I've been offered the opportunity to work with hundreds of millions of people through IBM, through the Walt Disney Company, right? So we can do things at scale using mobile first and multilingual technologies that we weren't able to do during my parents' journey back in the 60s, right? So we can bring emotional support, companionship into this community. We could do it at scale. So I'm going to show you how we're doing that. And then I'm going to give you really some really wonderful tools to take out of this learning and this conversation that you can implement in your own life, because it is an emotional toll, okay? And it's not talked about. It's a blind spot in our society, in our community, and possibly I'd offer to you even in our own psyche. So the Rare Givers Global Network exists to address the blind spot. We're doing emotional support with caregivers and patients and professionals in rare, chronic, and complex disease communities. And we deliver daily compassion and relief. We're doing that on all channels of engagement, through social media, through blogs, through YouTube, and pre-recorded and live recordings, but also through peer-to-peer connection in support groups and in-person connection through retreats. And we're not just doing all that as an individual organization, we're doing it in community. So we're doing it through our partner network, right? And then we've got everybody talking about the Rare Givers Emotional Journey Map, which is a guide to how to have these conversations. And we're rolling this method out across the world through hospital networks, in particular, rare disease centers of excellence. We just shipped our guidebook to rare disease centers of excellence in 6 continents, and literally just did that during Rare Disease Day this past month. So our goal is to emotionally support 3.5 million rare givers by 2026. So why? Why 3.5? And the answer is that's 1% of the need. Okay, so we can't do this without you actually listening and internalizing and then making a commitment to yourself. Because in committing to yourself for self-care, you're now going to be giving back. So we become now a catalyst through you to give back into the community, start talking about your feelings and your emotions. That's how we're going to get to 350 million. It's not going to be directly through us. It's going to be through you working on yourself and working in the relationships that are the most important to you and in your social circles and your professional circles to talk about your feelings. That's what we're trying to do, is inspire those to talk about feelings. So we're doing that through big global awareness campaigns. We're doing that by bringing the Rare Givers method in language. And Ginger mentioned this earlier, but we met in New Delhi because we were delivering this training actually in Hindi. I don't speak Hindi, but we had a partner in New Delhi who was speaking Hindi, and we offered the audience, okay, would you like the materials in English or in Hindi, right? So thank you so much. Huge shout out to Microsoft, because there are employee volunteers at Microsoft that have been helping us do our translations. We have 12 translations, 12 different languages. We're working on 400 languages. And did you know that there's actually 6,000 languages on the planet? These rare dialects. There's 700 dialects in India alone. So, because of the power of AI, we can do amazing things to talk to people about their feelings in language. And then we can train healthcare professionals to ask caregivers and patients and each other in the hospital and professional environment, treatment environments. How are you doing? Let's talk about your feelings first, and we'll talk about treatment options and how we're going to move you through this experience, right? So all of the above, right? There are 25 spinning plates here, but we need to address this at scale very broadly. And we started with 7 women in our living room at a wellness retreat in 2019. And we've moved to over 21,000 families. We've got about 80,000 families that are subscribed and engaging with our content. And we've released about 1 million hours of wellness training. It blows my mind. People downloading and viewing our social posts, our blogs, and really opening up their mind that we're there. And we're not just there at the beginning or during the treatment phase, but we're there for many families after they've lost a loved one. Because the journey doesn't end. Remember, we're all here on the planet for a limited time. And we just want to ease that journey, whatever it is. So while the science is advancing, we're delivering emotional relief today. And I want to go straight, before we go into some of the meditations and other things, I want to go straight to the things that you need to do to bring emotional relief into your life. So we call these the 10 essential tips for sustainable rare givers. And here's the first. The first list is like things that you know that you should be doing for yourself. Sleep. You need to carve out time for sleep. And we know this, but we have thoughtful suggestions on how to do that in the guidebook. So sleep, getting out in nature, okay? Actually thoughtfully putting good, healthy food into our bodies, being mindful with breath work, the physical activity that we all know we should work out more, but even if you're just getting out in nature and walking for a little bit and maybe listening to a mindfulness podcast for 10 minutes, then you've checked off like 4 or 5 of these at one time. Coming into community with others, finding some sort of emotional support outlet that may be professional counseling, but it also could be peer-to-peer therapy and group therapy. And then self-care skills building. So that's what we're doing here. And then really engaging with community resources. And you wouldn't have come to this session if it wasn't for Sickle Cell and Thalassemia Patient Network. So thank you for inviting us. And thank you to all of the sponsors that have made and donors that have made these services optional and available as well. So thank you. Now, okay, I promised some research for the left brain thinkers of the world, because here's the thing. I want you to think about this differently. So all of us go through stressful events. So on the red line is a stressful event, right? You're kind of humming along emotionally. Some sort of stressful event comes, you sort of ratchet up emotionally, your stress response kicks in. But then when the stress response is over, you sort of go back to a baseline in most people's stressful event scenario. The thing about caregiving is that once you go into a patient experience or a medically complex experience, you're now buzzing at this level, zzz, right? And you're sort of now in this like higher range of stress, okay? Because you're rheumatizing about, you're sort of going through your mind again and again, reliving, or you're anticipating a response of something down the road. That's from UCSF, and I'd like to thank Dr. Alyssa Eppel, for sharing that research with us. If you really want to geek out on it, you can go and download her book, The Telomere Effect, because it shows at a cellular level the stress response. It also shows at a cellular level how we can repair our telomeres with these sort of mindfulness trainings. So rare givers, I say, often suffer from CTSD, not PTSD. It's not a post-event. It's a chronic traumatic stress response. And the way that you deal with that is different. Okay, CTSD is different. And so here's the thing. There's lots of different kinds of what we call support out there. And this article with Psychology Today talks about informational support and tangible support. So the thing about informational support, it gives you education about a disease. What are the symptoms? What clinical trials are available? Tangible support is, how do I get my insurance claims covered? How do I handle childcare, get respite relief, right? Or get help with daily living tasks? But those aren't necessarily stress relieving types of support. They're things we have to know, but they're not necessarily taking our stress levels down. The things that bring your stress levels down are emotional and companion oriented. So being recognized and witnessed for the authentic emotions that you're having, and then being in community while that's happening, is very powerful stress relief. Okay, so I just want to be clear, because a lot of times we say, oh, we're providing support to the community, or I'm receiving support, but I want you to be discerning. I want you to think about what kinds of support have you been providing or asking for, and then where are you creating space in your life for emotional support and companionship, because ultimately that's going to bring the greatest relief. And gosh, Joffrey attended one of our men's retreats. We typically do women's retreats, but we had a partner say we have to do a men's retreat. So we did our first men's retreat. And Jeffrey is living with Crohn's disease, but he's also a rare father. And he says, I just needed to learn how to turn off, because I keep giving all of myself, or 99% of myself, and leaving myself in a deficit. And so here I am running a foundation, but I'm also a patient, and the two are sort of counter to each other because I'm not caring enough for myself. So I can't help anyone without realizing that self is first. So breathe. Notice he says, breathe first, center yourself, assess my pain, and mediate it, and do that first, and then get into a situation where we can help others. So we don't fix at Rare Givers, we witness. And the way we do that is through the Rare Givers emotional journey map. So this journey map is free. It's downloadable at raregivers.global. And really what it's designed to do is orient people when life gets medical. Because as soon as life gets medical, you end up on this isolating island. And there are predictable stages, but not always linear stages. So you could be in a diagnostic phase and end up in an end of life experience, or worried about an end of life experience, 911 call, you're at the hospital. So you may be worried, or you may be grieving about what you thought life was going to look like, but the reality of what, your experience is looking like, or your loved one's experience, or what parenting you thought parenting was going to look like, is different. Okay, so these are tools. These are talking tools, and the thing is they go in cycles. You're not always in hope. You're not always hopeful, and you're not always in grief. You're not always sort of, just leveled on the ground or in tears. These tend to kind of live. I mentioned it before. It's the yin and the yang. It's the joy and the pain. It's the light and the dark. It's the hope and the grief. And really, these are very natural cycles for all of us to go through in the community. It's very, very typical to be scared, to be fearful, to be anxious as you're engaging with the healthcare system, especially if you never really have in the past, or if you're trying to find the right information about disease or symptom management. And thank God for organizations like Sickle Cell Thalassemia Patients Network for providing that information into the community, because otherwise we'd just be Google searching, and we know how dangerous that can be, right? And then we get into these mindsets that you need to be the savior, but go easy on yourself, right? Because that's very hard to live up to. So just take it in I always say take it in threes when you're trying to discover information. Get three good sources or three pieces of advice, and then make a decision and move forward. So power of three. When you're in a diagnostic phase, that also can be very complex because you're managing symptoms either in yourself or in a loved one. You're discovering the reality that there may not be an answer, or not in the way that you thought. It gets very complex, especially in how our healthcare system is set up. It is not set up to be family and patient friendly, unfortunately. There's lots of different specialists. And it can be quite overwhelming and fatiguing. And so just recognizing that that is the case and doing the best you can. Always ask for care coordinators, either from your insurance company or from your hospital network, because they can help so much with setting up appointments and getting you to other emotional support resources within the organization or the hospital that you may not have realized. And then release that hero cloak, right? We set ourselves up that we need to come in and be the hero. The reality of shifting responsibilities is typically pretty profound in families. And so talking about how your identity, and naming your identity. I'm a mom, I'm a dad, I'm a tech worker, I'm, the UPS guy to bring in money. I'm, also catering on the weekends, and I'm also trying to be a circle leader in this organization, and I'm trying to give to my church, and I'm trying, and it's just like recognize all the roles and be realistic about where you can spend your time. It can also be challenging to be the expert. All of a sudden, you're educating people that you feel should be educating you. You're like, why am I the expert? You're supposed to be the expert. And that can be a real shock. And people can be resistant to that role. And that's a very typical feeling. Doesn't mean you get to step out of the role. You may still have to stay in it. But just know that's not a unique feeling, and that it can be a little challenging. The realities of full-time care, particularly as relationships get impacted. We need to really, really get the marriage counselor, get someone for your teenager to talk to, for your sibling, your unaffected children to talk to, or yourself to talk to, right? We need our social support services because the isolation is real. And what we're trying to, come across here is that you can live over here in this tent by yourself and try to be the hero, or you can come into community and get that support that you need in community. So as you're an advocate, just be aware that there's ongoing health and financial stressors that need to be navigated. And a lot of times there's really good advice that can come from community in doing that. And then as you're thinking about the end of life experience, just know that that is a real feeling, right? Whether it's a real stage is different. The feelings are predictable, right? Denial, anger, bargaining, depression, acceptance. These are well documented stages of grief. And actually, they've added a sixth stage of grief called finding meaning. And that is what we do. We give back into our communities. And so we just want to be thoughtful about how you can find your meaning. And it doesn't have to be a public meaning, right? It can be, I'm going to journal for myself and find my way to find one thing today to be grateful for, right? Or I'm going to give back in some other way. I'm going to make a donation yearly, or I'm going to volunteer to mentor someone if it's not too taxing for me, or I'm going to pull back I attended a session yesterday, Leadership in Heels, and one of the words was boundaries. Are an act of self-care. And that's okay for you to pull back that time, right? So, those are the 10 essential tips for bringing relief into your life experience. And I'm going to give you another tool now. It's called the meditation. And so I'm asking you, take everything out of your hands and put your feet flat on the floor. And we're going to close our eyes and we're going to walk along a path. And as you walk along this imaginary path, I want you to make it very sensory real for you. I want you to think about the gravel crunching under your feet, or maybe your path is on a beach and you feel the sand between your toes and you hear the seagulls in the background and the waves crashing. Or maybe you're in the woods and you can smell the pine and the pine trees and the flowers springing up in bloom. And as you walk along your path, up ahead is a rainbow. And it's beautiful. Remember that feeling you get when you see a rainbow? It's hit you now, and it's so vibrant. All the colors of the rainbow, red and orange and yellow and green and blue and indigo and violet. Just these bright, beautiful colors. And as you walk down your path, the rainbow is moving towards you, and one color is getting brighter and brighter. That color is bathing you in its light. It is all around you. It is the essence of who you are. So hold on to that color. Gently open your eyes. And I'd like to share with you how to put meaning behind color, because I use color in really creative ways. If I want to boost, I will use different colors of eyeshadow or the color I choose to dress in that day, the color of my car, colors that I paint in my house. So red symbolizes life and action and vitality and strength and love and courage, or whether that be orange, the youthful joy and vibrancy and happiness, or yellow, the life-giving energy of the sun that symbolizes intellect and wisdom, or green, color of money, certainly, but also Mother Earth. That's how you find balance in well-being and nature. And blue, that color of security and trust and compassion and calm. Or maybe it's indigo, that sort of infinity color, right? The spiritual color of grace and personal deep thought. Or violet, that very noble color of judgment, good judgment, preciousness, and sacred energy. So think about your color, and this is such a great exercise to do like at the family table when you have your next family reunion, or if you're doing an icebreaker at work. Everybody loves this. If you can't find this deck, don't worry, just Google, colors of the rainbow and meaning, and you will find these various different colors. It's a really fun one. But you can take that through your life and you can share it, like I said, as an icebreaker. So, okay. I'm running out of time, so I want to share sensory self-care tools. So here's something for you to remember on how to reframe daily rituals, because we don't have enough time. The number one thing that data shows and that we know in working with families, patients, and professionals is that I don't have time is the number one response. Okay, so what I'm challenging you here is these are reframes on time you're already spending. Okay, so these are micro moments you're going to take back and you're going to flip around that micro moment and you're going to put it in service to yourself. And the way you're going to remember this is through the five senses. So not all of us have access to our five senses, but many of us are aware of the five senses: sight, sound, taste, touch, and smell. Okay, so those five senses, often we have a dominant sense, so you can lean into that, but you can use the other senses as pathways into self-care. So if you're very touch oriented, which I am, you can use softness. So I have the most ultra soft robe. I have my ultra soft blanket. I have ultra soft clothing. So my family knows when I come home at the end of the day, I change out of my work clothes and into my ultra soft clothes. That's a symbol that mom's available, right? That wifey wants a hug, that I'm decompressing out of the flow of the day. And then ironically, I actually use that in the morning as well. So sometimes I have a big day ahead of me, and my comfort moment, I put on my ultra plush, ultra soft robe, and I go get ready for that big day. But then I, pull that off and save it for the end of the day again, right? So that's just one idea on how to take back that micro moment into something that's in service for you. If you're taste oriented, you're likely already doing some sort of warm drink ritual or some sort of drink ritual, whether that be, ice water. Could you add some sort of essence of blueberries or your favorite fruit? Or if you're doing a warm drink like coffee in the morning, I create goddess coffee. I actually sprinkle all sorts of things in my coffee when it's percolating. And then I'm taking a few deep breaths while that's percolating. And then you all know I use my Wonder Woman mug to be a double reminder, both a taste and a visual reminder of my strength and my need to repair from the inside out. So keep those rituals in place. If you're very auditory oriented, sound and music can be profound. I would challenge you to take it beyond that into these amazing guided meditations. So you can find them on Rare Givers YouTube channel. But also, Padma Gordon is one of our health and wellness practitioners. She's one of the most downloaded and listened to practitioners on Insight Timer, which is an app that you can download. Amazing. If you're smell oriented, which my husband is, he's very, very olfactory oriented. Essential oils can be amazing. You can use aromatherapy. And, essential oils, when you buy them, can be kind of expensive, especially the organic ones. Just peel an orange, take the rind, put a twist on it, and then put that orange oil right on your wrists. Take a deep breath and you have like an instant emotional boost. We have a lot of our rare givers using aromatherapy during the witching hour, they call it, like that period in the middle of the afternoon, either when you get tired or kids start getting cranky, or you want to make a transition from school into home or from work into home, whatever that is. Aromatherapy can be just, even set on a timer to have lavender just floating through the house can just change the whole mood of the environment. And as you know, I love Wonder Woman, very sight oriented. That's my dominant sense. So I use symbols a lot. And we have a partnership with Collective Hearts, which is a jewelry designer that makes big giant hearts or hearts that we can wear on our hands or our ears or our neck. But anything that gives you this idea, or it could be a Green Bay Packers sweatshirt, it could be, a t-shirt that's in your color, right? We talked about that. So anything that triggers your sight. So I can't say it enough. Top 10: sleep, nature, nutrition, mindfulness, physical activity, social connection, emotional support, counseling and therapy, self-care, skills building, and engaging community resources, which you're already doing here, but try to do a few of the others as well throughout the course of your week. Those are my offerings to you. It is my wish for you that you find sustainable emotional relief. And you've got breath work, you've got the journey map, you've got the rainbow meditation, and you've got your five senses that are all in service to you. So please remember that those are the pathways to empathy, love, forgiveness, and connection. And that couple, Richard and Phyllis, that married, lost three of their five children, and divorced in 1975. They actually were apart for 35 years. They married two other times each. So second marriages, divorced, They each remarried a third time, lived 20-year-long marriages, widowed within a year of each other. The same year our daughter Chloe was born. My mother's a carrier of Hunter, I'm a carrier of Hunter, and so is Chloe. So we have three generations of families that have been deeply affected by rare disease. And what came about was Richard and Phyllis started dating again 15 years ago. And then last year, actually 2023, 60 years after the first time they married, we married them again at 80 years old. So Richard and Phyllis, Crystal, Chloe, Jim, my brother Richard, and all of my brothers, David, Jared, and Randy, in the night sky, I view them as the constellation Orion. We are sending our blessings to you. Thank you so much for joining this presentation, and I hope that you found something to connect into that brings relief into your life. Please feel free to reach out and connect with us. And for that, I just say thank you. Thank you so very much. You're on mute. I can't hear you, Ginger.
Well, good, because I don't want to I didn't want to interrupt your presentation saying wow a lot. We some of what you were saying were, tagging it and putting it into the chat, and people were, sending up reactions to it. But that your parents, I'm remembering now that you told me that they got back together, but to hear it again is still like, wow. 60 years later in their 80s to start dating and remarry, so that no matter what, with all of the trials that they had, they were meant to be together.
Yes, yes, and meant to learn, through life. Like when I talk about marinating your heart, I think that's what my family went through. They went just through this deep marination. And my mother now is on the board of Rare Givers. She attends every Tuesday, Thursday support group for women the last 5 years. Barring maybe being sick or traveling, but she has attended. So she's done the work to come in community and be able to think about and talk about and voice the feelings that she had going through and that she still has. Because these journeys, they're a lifetime long, and the feelings can be managed, but they don't always go away, right? And so that's, I guess, if we've done nothing right, we've done everything right by our family, and we just offer this in service to you and to your community as well.
And for those of you, I want to shout out to the people who have joined on Facebook Live, and who have been sending their reactions and making their comments. Thank you for joining us. And I hope that you have a lot of takeaways. Please do go visit Rare Givers Global's website, go access the tools and the documents that they have, and start to work on developing your social supports. If you do not have it, you are always welcome to join their support meetings 3 days a week, as Crystal said, and, be part of that. And also, join us at SCTPN. And no matter where you are in New York State, we have an affiliate in Westchester, Rochester, Albany, Buffalo. We even have affiliates in Belize, Uganda, and Gambia. And, new partners from around the world reaching out all the time. So we're sure that that demographic will grow. There is no reason to suffer in silence and to be in a silo alone, thinking it's just you. As it was said in the presentation earlier, 350 million, possibly 400 million people living with rare disease and chronic illnesses. There are a lot of folks to be able to connect with who can understand what you are going through, and you all can be there for one another, and we can be there for you as well. So with that, thank you so much, Crystal, for taking the time out on your Saturday morning and afternoon to
We
be with.
always end sending lots of good love and doing some self hugs. So
Yes.